The headache started in July, sudden and explosive like lightning striking inside my skull. By August I was experiencing double vision. By September I couldn't walk a straight line without stumbling into walls. It's just migraines, my mother said when I mentioned it at Sunday dinner. She was the director of nursing at Riverside Regional Hospital, 25 years in healthcare management. You're stressed from that new job. Take some Excedrin. My sister Nicole nodded. You've always been dramatic about headaches. I was 30 years old, a marketing director for a pharmaceutical company, and I knew these weren't normal. Mom, I'm losing my balance. I fell twice at work this week. Balance issues can come from inner ear problems. Very common with stress. You probably have vertigo. Get some Dramamine. I think I should see a doctor. I am trained in assessment. Trust me, Emma. I've seen thousands of patients with migraines. This is textbook stress response. My father barely glanced up. Your mother's the director of nursing for the entire hospital. If she says it's migraines, it's migraines. I left dinner with my head pounding and the room spinning. 2 weeks later I collapsed in the parking lot of my office. My coworker found me seizing on the pavement, unconscious, blood pooling from where I'd hit the concrete. I woke up in the ER at Metropolitan Medical Center. A neurologist, Dr. Sarah Chin, sat beside my bed with MRI scans. Emma, you had a grand mal seizure. There's a mass in your brain. A significant one. We need surgery as quickly as possible. A mass? Like a tumor? Yes. In your cerebellum, which explains the balance issues and headaches. It's approximately 5 centimeters and causing dangerous swelling. We need to remove it before it causes permanent damage or kills you. How long has it been there? Based on size and symptom progression, probably 4 to 6 months. Emma, did you see anyone about these symptoms? My mother. She's the director of nursing at Riverside Regional. She said it was stress-related migraines. Dr. Chen's expression hardened. Your mother dismissed progressive neurological symptoms for months without recommending imaging? My surgeon, Dr. Marcus Reed, was one of the top neurosurgeons in the state. Emma, this is serious but operable. We're scheduling surgery in 2 days. The sooner we remove this, the better. 2 days. We need pre-op tests first. This can't wait longer. You're at risk for another seizure, brainstem herniation, or sudden death if we delay. I called my mother from the hospital. Mom, I collapsed at work. I had a seizure. They found a brain tumor. I need emergency surgery in 2 days. Long pause. Then irritated, a brain tumor? That seems extremely unlikely. You're 30. Brain tumors are rare at your age. Are you sure these doctors aren't overreacting? Mom, I've had MRI and CT scans. There's a 5-centimeter tumor in my cerebellum. The neurosurgeon says it's life-threatening. 5 centimeters seems very large for something that just appeared. Are you certain you're reading scans correctly? Sometimes radiologists see shadows that look like masses but are just normal variations. The tumor is causing my symptoms. The balance problems, the headaches, all of it. Who's your neurosurgeon? Dr. Marcus Reed from Metropolitan Medical. Pause. I've heard of him. He has a reputation for aggressive treatment recommendations. I really think you should get a second opinion before you let someone operate on your brain. Dr. Reed said if I wait I could die. Neurosurgeons always say that. It's how they justify expensive procedures. Look, I'm at a regional nursing conference this weekend, but I'll call you when I get back. Don't make any hasty decisions. The surgery is in 2 days. Then postpone it. Tell them you need a week to consider options. Any reputable surgeon will understand. Mom, this is an emergency. Nothing is such an emergency that you can't take days to think it through. You've always been impulsive about medical things. This is probably the same. They're seeing something minor and calling it an emergency. She hung up. Nicole texted, Mom says you're having some minor brain thing removed? Try not to make a big deal out of it. My friend Jenna moved into my apartment to help prepare for surgery. She took time off work, helped me arrange medical leave, and sat with me during pre-op appointments. Your family isn't coming? The pre-op nurse asked. They're at a nursing conference. They think this is unnecessary. Before surgery, Dr. Reed asked me to sign consent for medical documentation. I record all major consultations for quality assurance. Is that acceptable? Of course. I'd also like permission to record conversations with your family about your care, given their dismissiveness. This protects both of us if there are questions later. Yes, please do that. Dr. Reed performed the surgery on September 28th. It took 11 hours. Much longer than expected because the tumor was more invasive than imaging showed. But he successfully removed the entire mass with clean margins. I woke up in ICU with my head wrapped in bandages, a drainage tube from my skull and excruciating pain. Jenna was there holding my hand. The ICU doctor came by. You're very lucky. Dr. Reed got the whole tumor. You'll be here about a week, then home recovery for 6 to 8 weeks. Did someone call my family? We left messages. No response yet. My mother was at the Regional Nursing Leadership Conference, presenting a workshop on patient care standards. The conference was being live-streamed. On September 30th, during a break between sessions, my mother was in the lobby talking to colleagues. One of them was filming the conference venue and accidentally captured the conversation. How was your weekend, Patricia? Someone asked. Oh, exhausting. My daughter is being dramatic about some minor medical issue. Apparently she let some surgeon convince her she needed brain surgery. Can you imagine? She's always been like this, making a fuss over migraines. I told her to take Excedrin, but she insists on creating these elaborate medical crises for attention. Several nurses laughed. What kind of surgery? They removed some small growth from her head. Probably benign. But she's acting like it's life-threatening. She actually wanted me to cancel this conference. For headaches. I'm not canceling my professional commitments because my daughter wants attention. Is she recovering okay? I assume so. I haven't called to check because I don't want to encourage this behavior. The more attention you give these attention seekers, the worse they get. Sometimes you have to use tough love. The person recording didn't realize what they'd captured. When they reviewed their footage, they heard the exchange. They posted it to a nursing professionals Facebook group asking, "Is this appropriate for a nursing director to say about her daughter's surgery?" The post went viral within hours. Thousands of nurses commented expressing shock. Several people recognized my mother and tagged Riverside Regional Hospital. Then someone else commented, "I work at Metropolitan Medical." I looked up the records for Patricia Morrison's daughter. She didn't have minor surgery for migraines. She had an 11-hour craniotomy to remove a 5-centimeter cerebellar tumor. She was in ICU for 3 days. This wasn't attention-seeking. This was emergency neurosurgery to save her life. The post exploded. Within 24 hours, it had been shared over 50,000 times. News outlets picked it up. Riverside Regional's Facebook page was flooded with comments demanding my mother's resignation. I was still in the hospital, barely conscious from pain medication, when Dr. Reed came to my room looking grim. "Emma, your mother's comments about your surgery have gone viral on social media." He showed me his phone. The recording. The Facebook thread with thousands of comments. The news articles about the nursing director who mocked her daughter's brain tumor. I started crying. "There's something else," Dr. Reed said. "Remember I asked permission to record conversations with your family? I recorded my phone call to your mother after your diagnosis. With your permission, I'd like to submit that recording to the state nursing board." Why? Because your mother is a healthcare administrator responsible for patient care standards. She demonstrated gross negligence dismissing obvious neurological emergency symptoms. If she did this to you, what is she telling patients and staff? This is a patient safety issue. Do it. The state nursing board moved quickly. They reviewed Dr. Reed's recording, the viral video, and my medical records. They also investigated patient complaints at Riverside Regional during my mother's tenure. What they found was disturbing. Multiple patients had reported that nursing staff under my mother's supervision dismissed their symptoms as exaggerated or attention-seeking. Several patients had experienced delayed diagnoses because nurses had been trained to be skeptical of patient complaints. The nursing board called an emergency hearing for October 15th. I was still recovering when Dr. Reed called. The nursing board hearing is tomorrow. They've asked if you're well enough to provide testimony. You don't have to, but if you want to speak, they'll accommodate you. I want to speak. Jenna drove me to the hearing. I still wore bandages, still had the drainage site healing, still walked with a cane. The hearing room was formal. The board chair, Margaret Foster, sat with 4 other board members. My mother sat with her attorney looking furious. This hearing is to examine allegations that Patricia Morrison, RN MSN, Director of Nursing at Riverside Regional Hospital, demonstrated serious lapses in clinical judgment, Margaret began. Ms. Morrison, you oversee patient care standards for approximately 200 nurses? Yes. Can you tell me about your daughter's medical situation in July through September? My daughter had headaches. She's always been prone to exaggerating. I assessed her condition and determined it was stress-related migraines. Did you conduct a physical examination? Not formally, no. Did you check her pupils, test her balance, or perform any neurological examination? I observed her during family dinners. She seemed fine. Margaret opened a folder. I'm going to play a recording from Dr. Reed's call to you on September 14th. Dr. Reed's voice. Ms. Morrison, this is Dr. Marcus Reed from Metropolitan Medical. I'm calling about your daughter Emma. She was brought to our ER after a seizure, and imaging shows a large cerebellar tumor. This is a neurosurgical emergency. We need to operate within 48 hours. My mother's voice. A brain tumor seems extremely unlikely. Are you sure you're not overreacting? Emma has always been dramatic about headaches. Ms. Morrison, I'm looking at her MRI. There's a 5-centimeter mass causing dangerous intracranial pressure. Without immediate surgery, she could die. 5 centimeters seems very large for something that just appeared. I think you're being overly aggressive. Emma should get a second opinion. There's no time. This tumor has likely been growing for months. The symptoms she described, progressive headaches, balance problems, vision changes. Those are classic signs of a posterior fossa tumor. You should have recognized those red flags. I'm her mother. I know when she's actually sick versus seeking attention. The recording stopped. The room was silent. Margaret looked at my mother. A board-certified neurosurgeon told you your daughter had a life-threatening brain tumor requiring emergency surgery, and you accused him of overreacting. Why? I didn't think it was that serious. You're an advanced practice nurse. You understand what a 5-centimeter cerebellar mass means. Why didn't you think it was serious? Emma has always exaggerated. She had a brain tumor. That's not an exaggeration. Margaret picked up another document. I'm now going to play the recording from the nursing conference. The viral audio played. My mother calling me an attention seeker, dismissing my surgery as minor, saying she hadn't called because she didn't want to encourage this behavior. When it finished, Margaret said quietly, while your daughter was in ICU recovering from 11 hours of emergency brain surgery, you were telling colleagues she was seeking attention for migraines. Does that seem appropriate? I didn't know the surgery was that extensive. Dr. Reed told you it was emergency neurosurgery. My mother had no answer. The board has reviewed patient complaints from Riverside Regional. We found a pattern of nurses under your supervision dismissing patient symptoms. We've documented multiple cases of delayed diagnoses and poor outcomes linked to this culture. Where did this come from? I train my nurses to be discerning. You've created a dangerous environment where patients' legitimate symptoms are routinely dismissed. The board deliberated for exactly 5 minutes. When they returned, Margaret's expression was severe. Patricia Morrison, this board finds that you demonstrated gross negligence in your assessment of your daughter's medical emergency, that you actively discouraged appropriate emergency medical care, and that you have fostered a workplace culture that prioritizes skepticism over patient advocacy. Your nursing license is hereby suspended immediately, pending completion of a comprehensive remedial program. Additionally, we are referring this to Riverside Regional for review of your employment. We are also recommending review of patient care outcomes under your supervision for the past 5 years. My mother's attorney tried to object. This hearing is concluded, Margaret said. Riverside Regional terminated my mother's employment within a week. The hospital launched an internal review, finding multiple cases of dismissed symptoms. Several families filed lawsuits. The hospital settled quietly. Nicole sent one text, I hope you're happy. You destroyed Mom's career. I blocked her number. My father called once to say I was dead to them. I spent 2 months recovering. The pathology showed the tumor was a grade 2 astrocytoma. Dr. Reed said I was healing well. 6 months later I was back at work full-time. My had returned. The scans showed no recurrence. I'm 31 now, 1 year post-surgery. My scans remain clear. My mother tried to get her license reinstated. The board denied her, citing lack of insight. She's now in hospital billing. The viral video is used in nursing ethics courses. Jenna is my closest family. Dr. Reed celebrates every clear scan with me. My biological family sends nothing. Some headaches are migraines. Mine was a brain tumor. Some mothers listen. Mine called me an attention seeker. Some recordings change everything. And some boards work exactly as they should.